Everybody, welcome to Returning to the Office Safety Protocols for COVID-19 for Dunder Mifflin. We are very excited to have you here. My name is Stephanie Schlegel. I am the Executive Assistant for the HR, Head of HR, CFO, and General Counsel of the New Jersey Devils. I'm also a graduate student at Rutgers University, and Dunder Mifflin has asked me to come and help them teach you what the correct protocols are for returning to work after a pandemic. Thankfully for the New Jersey Devils, I was actually on our coronavirus task force and helped start all of those rules for when we left the office. So that's why they consulted to me to help us get back to the office. Miranda?
Yeah, hi folks, I'm Miranda. So I'm an MCM candidate here at Rutgers University. I've got 4 years of experience in nonprofit administration and marketing and 3 years of experience as an educator. And I am with the Dunder Mifflin Stamford branch. So we have already implemented this program that Stephanie set up, and we're really excited to share with you some of the things that we think will be helpful for you at this Scranton branch.
If you could all take a moment to leave your email in the chat if you would like a copy of today's slideshow and webinar recording, we will be sending those out at the very end. So our learning objectives, we're going to go over the return to office plan. What does that mean? It's going to be all of the protocols that we are going to state in the office when you get back, whether it's, mask requirements, all of those things. Miranda's going to go over those at the end. I'm going to talk to you about what our task force is and what we've established. And finally, we're going to go over employee comfortability and timelines, because that is the most important thing, that you are comfortable with getting back to the office. So we're actually going to start off with a little poll. Which of the following helps prevent the spread of COVID-19? So it should be popping up on your screen. There we go. Okay, looks like everyone has voted. Yay, everyone got it correct. All of the above. So task force and employee comfortability. Our task force are the C-suite levels of Dunder Mifflin. It's our head of HR, it's our operations officer, the vice president of business operations, our head lawyer, and our finance, our CFO. Basically, what they have done is they've consulted an outside expert, a medical expert, a doctor, and they've come up with the best protocols to instate in our office. Miranda's going to go over a very in-depth description of each one of those, so you know when you get back to the office, you will be safe. We are also working to ensure that you are all comfortable. How are we going to do that? We're going to talk to you a little bit today, and then we're going to instate some HR groups. And what they're going to do is they're going to talk to you. You're going to be encouraged to talk to your bosses as well as other colleagues, and you have to feel comfortable coming to talk to us, because we're not going to know unless you speak to us. And finally, we've determined kind of a timeline that we're going to share with you today, and we're going to go over who is going back and when. So no one can make you return to the office. Legally, we're not allowed to. If you're not comfortable and it's not going to be safe for you, you can't come. The CDC wouldn't allow it. So you have to speak up and you have to talk to HR. And if you're afraid to talk to us in HR, you're more than happy to talk to your bosses, talk to your colleagues, talk to whoever you feel comfortable with. If you ever have any symptoms, you need to speak up. If you ever see anybody with symptoms, you need to speak up. You're not going to get in trouble. No one's going to be mad at you. So please do not be afraid. And if you are being pressured to go back to the office, you're not allowed to. If you feel pressure from your boss, from your other colleagues, you have to come and you have to speak to HR, because legally no one can force you back until it is approved by the CDC. So we're going to get a little idea of when everyone feels comfortable coming back to the office. Pop it up the poll. January, March, when a vaccine is available for everyone, either or none. It's up to you. Okay. So as you can see, everyone will feel comfortable coming back to the office when a vaccine is available. That's good, because we want you back in the office. Can't work from home forever, even though it is kind of nice sometimes. So our timeline. Essential personnel, we're going to start moving people back into the office in January, March, if they want to be. Who is essential personnel? That is our operations officer. That is our task force. They're going to be going back into the office just to get things set up. They're going to make sure everything is in line and make sure that everything is ready for you to come back when you are prepared. After everything is instated in the office, all the plexiglass is up, everyone has what they need, their hand sanitizers, their wipes, all of those protocols that Miranda's going to be speaking about. Once all of those are set up, we'll start taking volunteers back. It's up to you if you want to come in. You can speak to your boss. Does your boss want you there? Like, can you work out a day? Everyone will then get a link from HR with a poll and a survey where they will sign up to come back to the office. Again, it's completely volunteer. You can sign up at any point between March and May. Maybe you're feeling more comfortable, maybe you're not. Again, and if you sign up to come back, no one's going to make you come back. It's up to you. But you will get a day, or if you're feeling brave and you want to come into the office, you're more than welcome to come in on that day. We're going to go over our floor plans. Again, Miranda's going to consult those, and we're going to make sure that each floor only has a certain amount of capacity. So that's why you have an assigned day. Then finally, once the vaccine is nationally distributed, everyone will be allowed to come back once the CDC says, yes, you can have full capacity in your office. It should be known though, even after the vaccine is distributed and even after we're okay to come back, these protocols will not be going anywhere. We will be continuing with these coronavirus protocols for a while, so be ready. The most important thing that we want you to know from your HR team is that your safety is our top priority. We want to make sure that you are comfortable and you are ready to come back and you feel prepared. And so now, with that being said, I'm going to toss it to Miranda to go over all of those wonderful protocols that I keep referring to. It's time for you to finally know what they are.
Hi, everyone. It's so great to see you here today. These are some of the great things that we discovered when we implemented the return for the Stanford branch, and I really hope it will be helpful. We have a really clear idea on how to keep yourself safe as we return to work. So just as a quick glance, if you are taking screenshots or notes, this will be the slide to refer to when we send out copies of the webinar after our meeting today. But really quickly, masks are mandatory for everyone in the building. This shouldn't be surprising. I hope that you've been practicing this in your own space. EMTs will be at the door taking temperatures. As Stephanie mentioned, we have been using a medical consultant, making sure that we are as safe as possible. So this new staffer will be working on that with us. As you enter the building, and before you enter the building, you will also be using a daily symptom tracker or app. We will be going into this in detail later, and you will be seeing some changes in your space, including plexiglass on your cubicles, moved cubicles for social distancing, one-way hallways and elevators. And we just want you to know that we will be deep cleaning the office every night. We will have extra cleaning staff on hand during the day. All employees will be given the tools and the resources that they need to keep their space safe and to keep their own hygiene in a good place. And keep a reminder that all rooms and conference rooms and spaces should be reduced capacity, and we'll get into how you can figure out how to do that in our next slide. So first thing I want to point out is that you will be seeing this sign before entering rooms and spaces, and it should give you an exact number of how many people should be in that room. So a quick environmental scan before entering should be helpful. And beyond that, there will be tools provided for you so that you can go ahead and clean before and after your meetings. They will be available in the room with some instructions on how to do that. And of course, in conference rooms and in all spaces, you'll want to maintain a physical distancing by sitting 6 feet apart, and of course, continuing to wear your masks. So our overall goals and mission are not to inconvenience everybody, but we really want to prevent and reduce transmission among employees. As Stephanie said, your safety and health is our top priority. We want to maintain a healthy business operation and healthy work environment. And these changes will primarily include mandatory safety protocols and implementing policies and practices for social distancing. So some spatial changes that you will notice include plexiglass in your workspaces, a reduced room capacity, and one-way hallways. So if you take a glance at our floor plan here, you will notice that there are arrows, but don't worry, you do not have to memorize that. You can just look down at the floor and you should see how to go and how to move about your space. In advance, we want to ask you to please follow all guidelines and safety instructions. For your safety, all employees are mandated to communicate and report any COVID regulations. So if you see these policies being actively ignored by people and they're making you uncomfortable, or if you find that what we set up for your spaces isn't being maintained, or things have been moved in a way that doesn't honor these policies and protocols, or you have a great idea for making your space safer, we want to hear about it here in HR. So really quickly, on screen, you'll see a visual that correlates with each of these types of masks that are acceptable. So homemade masks that will fully cover your nose and your mouth, surgical or procedural masks with ties or ear loops, dust mask, or N95 mask without vents. We ask you to please not bring in anything with a vent. Please do not use neck gaiters or bandanas because the Mayo Clinic and the CDC and OSHA have all come to terms with some new research that is saying that those are not as effective to keeping you safe. So for your safety and others, please make sure that you choose an acceptable mask when you come into work. This is a great screen, again, to reference if you revisit our webinar and the slides that you'll be provided with in email after our presentation. But in short, face coverings must be worn in all public spaces. That's non-negotiable and it's necessary. They must cover your nose and your chin completely and fit securely over your face. And if you take a glance on screen, you should see some great examples on what that looks like. So for mask regulations, there are designated spaces that look like this in the office. And if you dispose of your mask in designated containers, it just keeps us all safer. Reusable masks should be regularly cleaned at home. So please do not neglect any safety on those just because you're not using disposable masks. And if you do need to change your mask for any reason, please do so away from others and outside of shared workspaces, preferably in your personal vehicle. So we're going to do another poll here. So take a moment to look at your options and just let us know, what do you think the following is false about COVID-19 in the workplace?
Okay.
Great. So of course, everybody is responsible for maintaining your personal workstations, and this is really helpful to keep everybody safe. So we really appreciate your thoughts on that. Okay. So before entering the building, every employee will be submitting a symptom screening assessment. You will be using the COVID symptom tracker. It's pictured on screen, so you know what the app looks like in advance, but just know that you will be receiving emails in the coming weeks about how to download it, tutorials, and we are all available on staff to help you figure out how to use those if you have any difficulties. This is really helpful because it helps us stay in touch with the CDC and making sure we're aware of what's going on with our health in the workplace and we can continue to come to work safely. So remember the 3 W's. You want to wear a face mask in all spaces on the premises. You want to wait and watch your distance, stay 6 feet apart and avoid close contact, and wash your hands often or use hand sanitizer. Plenty will be provided to you, so hopefully you'll be in a great position to keep up with your 3 W's. So this is, again, a slide that we'd love for you to go back to, reference, and spend some time with after the webinar. But we would really like to make sure that you're making sure that you're washing your hands efficiently so that it actually helps you. And hand sanitizer, again, will be available to you at your personal workstation as well as at all entrances and exits. Please do not remove your mask to cough or sneeze or for any reason in your workspace for our collective health and safety. So one final poll for everyone. When do you think that you should communicate a COVID-19 risk or concern? Great. So that's absolutely important. As Stephanie said, it's really important to articulate your comfort zone and any observations that you have. This is a job for everyone, our collective health, and it just really helps if you're speaking up, self-advocating, and making sure that you're being your best self-advocate by keeping an eye on things. So finally, we'd love to open the floor to any questions that you may have, and thanks for listening. If anybody does have any questions today, feel free to turn off your unmute or put them in the chat.
Well, this was a great presentation. I have a question. Have you actually used these procedures at your place of work?
I personally, you want to take, you can go first. Go ahead.
I'll go for it.
Yeah, I'm here.
Oh, do you have a question?
So these are for like protocols that are being used for, are you just talking about like the specific company, or is this something that mainly is like being used for most offices?
Yeah, I'd love to highlight a couple of places. So if you'll notice up here, OSHA.gov, that's a really great place to familiarize yourself with if you're ever interested in just all things corporate, because they are really the government agency that regulates safety in the workplace and the office. I come from a theater background, and we have to use it very literally when it comes to like cranes and construction spaces and stuff, but it also applies to everyday workplace safety, especially in unique situations like the pandemic. And they've been working a lot with the CDC. And what's interesting is it's not just the US that is using these protocols. They're also echoed. If you take a look down at the bottom, we looked at the UK Ministry of Health and what they're advising over there, because they got on top of their pandemic a little bit better than we did. And they have the same regulations. So they're pretty solid.
Oh, wow. Okay. Thank you.
Thank you. You guys did a fantastic job. It flowed
Thank
very
you.
nicely. You were very well prepared, very, very professional. Like I could see sitting through that webinar at work.
Thank
So
you.
really nice job.